Everyone, welcome. My name is Autumn Sipis. I am the Marketing and Outreach Coordinator with Canadian Coalition for Green Healthcare. On behalf of the Coalition, I would like to welcome you to the first of our webinar series, Climate Smart Healthcare Solutions, on the topic of reusable elastomeric respirators. Before we start today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day, and on whose traditional territories our work takes place. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering these questions at the end of our webinar today. So in this 1-hour session, you'll be learning about the future of reusable elastomeric respirators in Canada, how the status of RERs in Canada compares to that of the United States and abroad, the facility benefits of RERs, including safety, sustainability, and security, challenges manufacturers have faced and their experience during the COVID-19 pandemic, and how we can work to improve knowledge of and access to RERs. Presenting for the Coalition will be Mia Sarzin, our Environmental Healthcare Coordinator, and Linda Varangu, our Senior Advisor on Climate Change. We'll also be hearing from Barry Hunt, who is the President of the Canadian Association for PPE Manufacturers, or CAPM, who is also the President and CEO of Prescientx. We will also have Craig Lafferty, the Regional Vice President of Sales from Dentec Safety, and Jay Singh, Chief Commercial Officer of Precision ADM Medical. Now, I'm going to hand things off to Mia to begin the presentations.
Perfect. Thanks, Autumn. Hello, everyone. So my name is Mia Sarazin. It's a pleasure to be with you today to present you a project we have been working on for over a year now. This project is funded by Environment and Climate Change Canada. Our project is entitled Reducing Healthcare-Related PPE and Medical Single-Use Plastic Waste through Circular Economy Principle. And with this project, we wanted to demonstrate that hospital-generated PPE and MSOP material can be managed by applying the principle of circular economy. So we focused on 6 different types of PPE, so gloves, goggles, face shields, gowns, medical grade surgical mask, and filtering face piece respirator, also known as a reusable elastomeric respirator. For each of them, we wanted to know what was happening in the healthcare sector and how these different circular economy principles were applied and could be applied in the future. During our research, we identified benefits on the safety, security, and sustainability for each of them. We will show you some results today in the survey we conduct, but our guest speaker will also address it. We presented a webinar on this project a few weeks ago, so if you are interested in learning more about this project, I invite you to visit our website, as the recording will be available very soon. So as you can see for today's webinar, we will only focus on the reusable elastomeric respirator. So just a quick overview here about the status of reusable respirator in Canada and in the US, as our speaker will be discussing this element in more detail later. We have seen several examples during the pandemic of their use and how they were processed. We know that in the USA, elastomeric respirator have been used since 1996 in Texas to protect healthcare workers against tuberculosis. And in 2003 and in 2009, during SARS and H1N1, the CDC also recommended this respirator as an alternative to disposable N95 mask. And according to them, elastomeric respirator offer healthcare workers equal or even better protection for airborne infectious substances compared to the disposable N95 mask. In Canada, reusable elastomeric respirator have been recommended for healthcare worker by health agency across the country. So just think about Health Canada, Ontario Health, and the Quebec National Institute of Public Health, so the ENSPQ. In 2013, WorkSafe BC also published an assessment about the research conduct on elastomeric respirator and what needs to be considered for the use during a pandemic. You can also see here on the slide different type of reusable respirator that we know were used across Canada during the pandemic. And we are fortunate to have 3 companies here today to explain their product in more detail. To finish, what is still, well, surprising is that these reusable elastomeric respirator have been used in the US for more than like 25 years. And here in Canada, is it kind of a new product that was not really considered in the last decade, but became more popular during the pandemic, mostly because of equipment shortage. So we now have many examples around the world of the use of a reusable elastomeric respirator in healthcare, and several scientific studies have been conducted on the subject. But still, there is a lot of work that needs to be done. So considering the huge amount of PPE that were discarded during the pandemic, we really need to rethink altogether how we can make the healthcare system more sustainable. And this is why we wanted to have this conversation with you all today. So I will now like to hand over to my colleague, Linda Ravangu, who will present the rest of her project. Thank you.
Thanks so much, Mia. So what I'll be doing is, thank you, there we go, is starting off with an example of circular economy and how it could be applied to reusable elastomeric respirators and the different actors that are involved in the development and use of these. So just as an example, we have on here the resilient, sustainable, low carbon green hospital. Now, this particular way that we can encourage more reusable elastomeric respirators to be used is to have a green purchasing policy where the manufacturers are then encouraged to sell their products in Canada and to our health system. We have users that are using the reusable elastomeric respirator, and then these are being reused on site, cleaned and disinfected, potentially repaired if needed, potentially repurposed, for example, used in training if they can no longer be used in active healthcare work. In the end of the life of this particular respirator, the product should be recycled, and the filters, excuse me, the filters themselves should be plant-based and be composted and contribute to the domestic supply of raw materials to manufacture these. We would then have a domestic net zero material converter using sustainable packaging and providing input to the domestic net zero manufacturing facility, who then has of zero emission vehicles for distribution to the hospital. So this is just an idea of how we can promote the circular economy practices in the reusable elastomeric landscape. And I'm trying to, there we go. So we did do a survey, particularly on reusable PPE, and we wanted to find out what the healthcare workforce experience was with reusable PPE. The 4 items that we focused on were gowns, goggles, face shields, and reusable elastomeric respirators. We developed a survey at the coalition with input from experts throughout Canada, as well as our informed advisory committee. Thank you. So we had about 233 responders to the survey. It was held in the early part of the year. And those responders that were particular to the reusable elastomeric section were 70, although smaller numbers answered different questions. So starting off with some of the results that we've had here, where were these people coming from that used elastomerics, reusable elastomerics across Canada? The primary responders came from BC, Newfoundland, Ontario, and Quebec. We did have responses from Alberta, Saskatchewan, and the Yukon as well. in terms of people who have used elastomeric respirators and their job titles, we saw quite a few from the nursing sector, the pharmacy area, respiratory therapists, physicians, and many from facilities management. And the types of facilities that were represented here, the primary facility types were hospitals, although we did get some responses from long-term care, EMS, and dental clinics. Trying to move this along, sorry about that. And so for those of the respondents that knew what type of respirator they were being used, not all of them knew this information. Some of them were using 3M, Dentec products, Honeywell products, and MSA. Who is responsible for cleaning and disinfecting reusable elastomeric respirators? What's important to note in here is not the height of the graph, but the fact that we know that some of the facilities were cleaning and disinfecting by themselves at their facility, not responding to, not requiring centralized on-site cleaning, but we know that many facilities were using centralized on-site cleaning as well. And if used another type of reusable respirator, we wanted to find out which ones. There were some that used elastomeric full face as opposed to the half face, some that used the power air purifying respirator known also as PAPR, and a PAPR with a hood, although these were used in much smaller quantities as reported. And the reason for using these were primarily job-related requirements. And who when the people were using these reusable respirators, what departments were they primarily working in? And we see that the majority responded to, from the intensive care and emergency, although anesthesia and surgery, and then a host of others following that. So we wanted to see where they were focused their job activity when they were using these. We wanted to know their level of comfort with each type of reusable PPE. So we're also showing here gowns, goggles, and shields as well. But you can see from this, this particular graph is that very comfortable and comfortable were high on the agenda for reusable gowns, goggles, and face shields, whereas elastomeric respirators had a lower level of response in terms of their ideal comfortness. So we have a lot of work to do on that side. If you're using a reusable elastomeric respirator, what is the level of satisfaction? And we see that, again, there's some work to be done here as well. Not too many very goods, although confidence in cleaning was pretty good. But in general, it's variable, and it could be variable on the type of respirator. We have not we have not correlated those, but in general, there's some more variability here, and it just shows that this is a new product on the market that could actually benefit from some additional work in collaboration with the sector. And how important each of the following factors are regarding use of PPE, and in relation to the same type of PPE, which is disposable. So this graph encompasses all the reusable PPE, but just to get an idea of what the audience was, who they were when we were asking them to respond, and what their priorities are. So meeting safety requirements and meeting standards were the highest on the list here, but note that reduced waste, reduced single-use plastics were also significant, as well as confidence in cleaning and ability of the user to perform their tasks. So this group was actually really interested in making sure that we're working towards sustainability. Would you continue to use the reusable PPE even after the pandemic wanes if the reusable PPE was available? So again, we're showing all the 4 types of PPE, reusable PPE here, and the reusable gowns showed the highest retention on reusable gown use. Goggles and face shields were also fairly high, but we have some concern on the reusable elastomeric respirator side, where there's a little bit of a wobbling on the desire to continue to use it, having to do with many of the issues that were reported in the survey earlier. And finally, just leaving you with some ideas of some of the responses we got in terms of comments from some of the responders. This particular clinical services manager feels protected, feels that colleagues and patients are also protected with their reusable respirator. From this particular dentist, they indicate that it's no longer acceptable to have single-use products that don't have particular circular economy routes that we can go to. So reusables are really the driver that should be considered going forward. In this particular registered nurse, loved the idea of going green, but felt they needed N95 because they wear glasses. So that's maybe something that could be addressed by the manufacturers as well. So thank you for our part. I'd now like to turn it over to Barry to talk about CAPM.
Thank you, Linda. And so CAPM is the Canadian Association of PPE Manufacturers. So we're a group of now 16 companies across the country that are collaborating to work together with government to try to coordinate standards, to try to fast track improvements in products and technologies and materials for PPE, and to help make a sustainable PPE industry in Canada. So when the pandemic struck, as many of you know, there were no respirators or masks manufactured in Canada. There were no materials that were manufactured in Canada that would support them. And now we have a very robust industry. And so CAPM is composed of member companies who are very committed to a long-term sustainable industry for PPE. We work with Engine primarily, but we also work with all kinds of other departments, Health Canada, et cetera, in the government, as well as with CSA to help develop standards. We're Canadian owned and operated companies with a commitment to Canadian content. So we went from 0 Canadian content 2 years ago to 40% commitment last year, to a voluntary 80% commitment of Canadian content this year, with goals of getting to 100% Canadian materials and content for products by next year. We manufacture a number of different products, and we do manufacture disposables, but we do have innovative companies who have developed elastomeric respirators, which we're here to talk about today, and we'll save that for discussion by each of the individual companies. One thing with elastomerics is they are far more protective because they seal so much better than disposables. So N95s are very protective on their own, much more so than a surgical mask, which is much more so than a cloth mask. So as we go up the scale, the pinnacle really for masking is an elastomeric respirator. They're easier to fit, they're generally more comfortable, and they're far more protective. So even if you can pass a fit test with a disposable respirator, there's a good chance that it won't stay sealed throughout your activity during the day. So more protective. In the long run, they are lower cost. And we'll talk about that a little bit later. And they're definitely more environmentally friendly. So we have parking lots full of disposable masks. We have mountains of disposable masks and respirators, behind every hospital being shipped out. And we really need to get away from that disposable thinking. So one example that was brought up earlier, the Texas Center for Infectious Disease is a TB hospital in San Antonio, Texas, and it's TB and SARS too now. And for the 26 years that they've been using reusable elastomeric respirators, they have had 0 hospital-acquired infections for their healthcare workers. And their protocol there is on day 1 to give a new healthcare worker their own reusable elastomeric respirator, and that's theirs to keep and to look after and to change filters and to clean. It's a very pragmatic, very simple approach, and 0 infections in 26 years shows that it's very effective as well. The leak is the problem. And, people talk about N95s, N99s, N100s. Yes, they're good for higher and higher levels of protection against particles. But as far as bioaerosols, they're not really required, that higher level of filtration. It's the leak that's the concern when it comes to bioaerosol protection. So particulate respirators are the N95s that we think about today. And, when we use them in healthcare, we find there are issues, especially if they're disposables, or especially if they're hard to fit. I mean, you have to crank them down very tightly. The big problem with them, though, is they're generally too hard to breathe through. So at the end of the day, whether it's an 8 or 12-hour shift, the healthcare worker is suffering. And one of the reasons is we've been treating the bioaerosol, the liquid particles, droplets that are coming out as we're speaking, we've been treating them as particulates and as a subset of particulates. And we really need to have their own category of bioaerosols. And it's been discussed at standards committees for decades, quite frankly. But now is the time to actually enact that, and I'll explain why. If we use a bioaerosol respirator as opposed to a particulate respirator, we can get the same level of protection, virtually 100% protection against bioaerosol transmission, but we can do it with half the filtration material, which of course is twice as environmentally friendly and just as important for the healthcare worker. It's twice as easy to breathe through if you only have half the filtration material. So same protection, easier to breathe through, much less waste. So our standards that we have here in Canada, we were following the US NIOSH N95 standard up until year when we came out with our own version of an N95 standard, the CA-N95 going forward. And we had a standard for how to choose and select and which type of respirator to wear for different conditions. But it's all based on occupational health and safety. So it really only covers 18 million or 38 million Canadians. It doesn't cover children. It doesn't cover people who don't work for an employer who would have a respiratory-based program based on hazards in the environment. And so we really need a public respirator standard to cover all 38 million Canadians. And so CAPM has written a seed draft, and they've written it in the format for CSA type of format, so it can be adopted by CSA. And we've talked to a number of different government agencies who are generally in support of coming out with a public mask standard or respirator standard for bioaerosol protection. But that does take some time. We've proposed to have 3 different categories, but based on the amount of leak as being the important issue. So an ear loop would be BA1, BA2 would be a head strap version that fits a little better, and a BA3, of course, would be elastomerics, which seal the best for better protection. When we look at how hard respirators are to breathe through, most people who have been in the healthcare industry for years and years, like I have, they're used to respirators being very hard to breathe through. And that's because the N95 standard that we've been using for 50 years has a very high breathing resistance that's allowed. In our new Canadian standard that we just came out with, we identified new categories of easier breathing. So 175 pascals versus 245, and very easy breathing at 100. If we were to come out with a bioaerosol standard, once that becomes known, we would have even easier breathing categories. So now our resistance to breathing is about 1/10 of what a typical maximum standard would be for an N95. If we look at why we're trying to create a new standard, so the N95s are based on to stop these types of materials, these particulates, and really disease is being carried by these type of materials, so large watery bubbles that contain the occasional virus particles. If we look at our healthcare systems, we've been using reusable products up until about the 1970s. We started switching over to disposables. And the same thing really happened in the industrial area as well for respiratory protection. So they started introducing disposables about that time as well. And obviously the industrial respirator of the 70s became the N95 respirator of the 1990s, which is what's primarily in use today for respiratory protection. We think we need to further evolve this medical line so that we have a bioaerosol mask or bioaerosol respirator that's easier to breathe through, like all the medical products were prior to the introduction of N95. This is just a bit of context for what's really important. The virus might be only 120 nanometers or 140 nanometers in diameter, but it requires a bubble of at least 300 nanometers, typically 400 nanometers or more, to survive. And it's this bubble is packed with mucins, it's packed with salts, and then an occasional virus particle. If we look at the size range of the bioaerosols that we're emitting, we have a bimodal distribution. And we can see that most of the virus is being carried in particles that are about 500 to 5,000 nanometers in size. And so if we look at the tests that were done with a N95, the industrial respirators, versus what's being done on the medical side, or has been done with the medical side, we can see that we are in a completely different range. So N95 was down here for particles. Our viruses that we're concerned about are up here, and we use different mechanisms of filtration to capture those. And so this is the medical latex tests that have been done for surgical masks for years and years are actually more appropriate than the salt tests that have been done for particulate respirators for our concerns. So here's how we compare on the world stage with how breathable our products are. We have identified those two new characteristics, lower breathing resistance than other countries for particulate respirators. And of course, we would like to get to the bioaerosol ones much, much lower. When you look at the public mask standard or public respirator is definitely a demand for it. We have wave after wave after wave coming. They're going to continue to come faster, and we're going to have whole new organisms coming out in pandemics as well, like monkeypox, for example. And so we need something that will cover children as well as adults. We need national standards for that bioaerosol protection. We need something in a national strategic stockpile. Right now, the stockpile is primarily for critical care workers, healthcare workers, not for the public. And we need a mechanism for national distribution for those who can't afford it in order to make sure they're available where they need outside of key areas like healthcare right now. If we look at the drivers of community cases right now, schools and hospitals are two large drivers. If they used universal respirators, we would essentially cut our transmission rates in half, and that would really flatline the waves that we see now. That'll bring the rate of transmission below 1, which is what we need to do to stop exponential growth. And I'll pass it over to Claudia.
Thanks, Barry. It's Craig, but
oh, I'm sorry. Over to Craig. Yes, Craig today. My apologies.
Claudio is the president of Dentec.
Yes, my apologies, Craig. Thank you.
Good. Yeah, thanks very much, and great job. Thanks very much for including Dentec as part of today's session. So, wanted to provide a little bit of insight on Dentec, who we are, what we do, and how we came to develop a reusable elastomeric respirator for the healthcare industry. So, Dentec Safety, we are Canadian owned and operated, based in Newmarket, Ontario, have 40 years plus of experience in the safety industry and distribution. Like I said, our head office is in Newmarket, but a unique distinction for Dentec is that we own our manufacturing facility in Lenexa, Kansas. So that's where we produce all of our half masks, cartridges, and filters with a 100% US supply chain for all of those products as well. So during the first waves of the pandemic, we really ran into a lot of massive supply chain issues. Of course, our supply of disposable respirators was cut off from overseas. And that created a really big catastrophe in being able to protect our healthcare workers domestically. So we started to really look at the situation, our domestic manufacturing capabilities, and the realization that we can really do better for not only our community, but for our planet. As was mentioned earlier, disposable respirators and disposable PPE just create massive environmental impacts and waste. There was a lot of lack of consistent supply during the first waves of the pandemic. And that really prompted us to look at our designs of reusable respirators and come up with another option, which I'll explain momentarily. So a couple key things happened during 2020 and 2021. CDC basically came out and recommended using respirators without an exhalation valve for healthcare and frontline workers. The FDA also came out later in 2021 and basically said that elastomeric respirators, including those without exhalation valves, are a really great alternative to disposable N95s and filtering face piece respirators. So that kind of set us on our trajectory for developing what's now known as our Comfort Air NX. It was really designed with healthcare workers in mind: nurses, doctors, EMS, frontline workers, pharmaceutical, long-term care, and there's many, many more industries. Dentec was fortunate enough to be awarded a federal stockpile contract in the US from Health and Human Services. And unfortunately, at this point in time, we're still seeing that the US is a lot further ahead in their recommendation and their use of reusable elastomeric respirators versus Canada. Part of that is due to the seeding project that the US had implemented as part of this contract. So Dentec was awarded 125,000 Comfort Air NXMD respirators with about 600,000 pair of P100 cartridges to outfit hospitals, healthcare workers, long-term care facilities. And as a result, we've been able to get our respirator onto the faces of many, many, many healthcare workers throughout the US. We recently developed a case study with one of the large adopters, Cooper Healthcare Network, based out of New Jersey. It's actually it's a network consisting of 100 facilities, and they have over 8,800 respiratory users throughout those facilities. And they're moving to implement our respirator with every single one of those people who's a respiratory user through those facilities. So if you're looking for some really great information on implementation, sterilization, decontamination techniques that Cooper Healthcare Network was able to implement, I'd really encourage you to visit our website. That case study is available on www.dentecsafety.com. And there's also lots of great resources that we've been able to highlight on our website as well, partly through the adoption of Cooper, as well as many, many other healthcare workers and facilities utilizing our respirators over the past couple of years. Dentec was also fortunate enough to recently be quoted in the New York Times. As I mentioned, the awareness around reusable elastomerics is becoming a lot more common, more so south of the border. But there are a number of pieces that are being developed and journal articles that are being written on the benefits of reusable elastomeric respirators versus disposable options that are more commonly used today. So a couple key benefits with the Comfort Air NXMD. It does have two-way filtration. What we did when we designed this mask was remove the exhalation valve. And that would probably be the main difference between some of the more industrial construction models that are available versus this more healthcare-oriented option, which does not have an exhalation valve. So all of your inhalations and all of your exhalations actually pass through either the N95 or the P100 filters that are available with this respirator. So in the picture that's shown on the left, that's one of the N95 options, but we do also have this NIOSH approved in a P100 orientation as well. And those filters are interchangeable. So depending on your scenario and the level of protection you're seeking, you could switch out from an N95 to a P100. There's many features and benefits that are incorporated within this respirator, but really what we're most proud of is the fact that this mask and design was really built with comfort in mind. The breathing resistance is greatly reduced versus disposable N95s. We do have oversized inhalation and exhalation ports, which means getting air in and out of the respirator is very easy. As was mentioned by Barry and others, you do have superior protection in an elastomeric, and comfort is really king. So we're really proud of the fact that we've developed a very comfortable, easy breathing mask, and that's going to just result in higher user adoption in the field. In fact, Cooper Healthcare Network and the some of the quotes that are in that case study do talk about the comfort and the wearability of this respirator, which is really great. So it is available in a couple sizes as well, which is really important. Obviously, in healthcare settings, you know, you got people of different face shapes, sizes, ethnicities, and being able to offer a product in multiple sizes means you're going to be able to have a wider fit factor rate or a fit pass rate, I should say, for your workers that are in your facilities. One of the big benefits with elastomerics, though, is that they are more anatomically designed. The two sizes do fit a lot better across a wider variety of face shapes and sizes. So again, when you have a product that's better designed and more ergonomically designed, it is going to be more comfortable on the face, and providing a proper fit provides superior protection as well. So as I mentioned earlier, our product is NIOSH approved in both an N95 and a P100 orientation. It's also Health Canada approved as well. Health Canada more or less accepts NIOSH certification. So it's good to go both sides of the border. It is recommended by the CDC and Health to protect against viruses. And the user, the patient, cannot touch the filter when the mask is in use. So that's one of the nice things that we incorporated into the design, is that comparative to a disposable respirator where that filtering material is exposed to the touch, we wanted to make sure that our filtering material was not able to be accessed easily when the filter's in position. So much less transmission, should fomite transmission be a concern. So not really just for SARS-CoV-2, but potentially many other types of viruses that might be airborne or be transmitted via fomite. So this is a really good option. Easy to disinfect, easy to sterilize. You can wipe down the filter housing. Again, without touching the filter, you can wipe down the exterior of the mask, wipe down the interior of the mask. And it lends itself very well to being able to be cleaned by the user immediately after doffing the respirator, but it's also very easy to go into pool decontamination, pool sterilization, if that's a process that's being used at your facility. So being able to protect that filter extends the filter life, and it reduces costs and reduces waste. One of the cool things that the CDC came out with was that a filter, assuming that it has not been visibly soiled, damaged, or wet, you could potentially, or conservatively, is the language that they use that filter for upwards of a year. So again, very economical, and helps to greatly reduce waste. And that's really what we're here to talk about, is the amount of waste reduction that can be implemented by using a reusable elastomeric. Globally, about 129 billion disposable face masks are thrown into landfill every month, which puts a yearly consumption into the trillions. And those plastics can take up to 450 years to break down, so huge environmental impact. Not only is the environment of utmost concern, but also a lot of people's facilities budgets have been crippled by the ongoing cost of disposable respirators. And so we have instituted a calculator, cost savings calculator on our website as well. Again, you can feel free to go and check that out. It's an interactive cost savings calculator, so you can just input your data and come up with a cost savings and a waste savings for your facility. But just some quick numbers, even if we're looking at one person seeing 5 patients a day, current practice is that you should be disposing of your disposable respirator after each patient interaction. So at the cost of $2 per mask, if you're only seeing 5 patients in a day, you're going to spend about $10 per one person, $50 a week, or $200 per month. So if you have a facility of, say, 1,000 people, you could be spending $200,000 a month just on disposable respirators, which end up in the trash. Linda had brought up some principles earlier of the circular economy. Obviously, using reusable elastomerics, you can kind of climb up the ladder within the circular economy here. And conservative estimates that have been coming out thus far and our evaluations have shown that we can reduce landfill by upwards of 90%. And that is also true of the costs of reusing a reusable elastomeric as well. You can actually save about 90% versus or more versus disposable respirators. So in short, safer, more comfortable, sustainable design, less waste, less cost, NIOSH approved, made in the USA with a 100% North American born raw materials, and very easy to stockpile, available when you need it. What I really want to drive home about this is that typically disposable respirators have a shelf life of 3 to 5 years. So you're constantly having to replace that stockpile if you're not utilizing them. Whereas reusable elastomeric respirators can be stockpiled much more easily, much more economically, and for a much longer period of time as well. So that product and that protection is available when you need it. Maybe it's not SARS, maybe it comes next, but that level of protection is going to be available and really circumvents a lot of the supply chain issues that we've been struggling with for the last couple of years. So with that, I will hand it over to Jay Singh from PATM. Thank you.
Hey, thank you, Craig, and thank you for Green Coalition's team to really put us and give us this opportunity to talk about Precision Air. That is our really a gold standard product, and which we were able to launch here in late 2020 initially in Manitoba. And I do want to make a comment quickly here on the survey. Manitoba Shared Health did not submit the survey to Green Healthcare Coalition. I think if they have done it, I would have said in Canada was used for half mask respirator or RFRs would have been skyrocketed, because the Precision Air mask is used throughout Manitoba hospitals, from clinics and the outsourced nursing facilities as well. So it is definitely is used in tremendous different ways here in Manitoba. With that, quick background on our company, PATM Medical. PATM Medical is a subsidiary company of PATM Group and Precision ADM. We've been actually in the healthcare business for 17 years. Initially, our business was into the improving the implants outcomes for orthopedic side of intervention and watching those people for long-term studies and so on. That's what we did as an initial organization called Orthopedic Innovation Center. Precision ADM was founded as a principal organization to work in improving the implant outcomes. And our pivot in early 2020, when the pandemic started, we've seen the huge need of PPE in the business. We initially brought in Canada's first 3D printed swab to National Microbiology Lab. And then suddenly we realized that we need to work something towards reusable N95 scenarios. We won the challenge from Manitoba government to develop a healthcare grade surgical half mask respirator. That was the Precision Air, the RFR, which we're going to discuss today. And our journey continues with that into the 3-ply masks and then to now plant-based materials. So we now have compostable plant-based materials, which we are converting our filters to regular masks and others to stay sustainable in this marketplace, as well as our promise towards environment around us. So Precision Air is our product. It's made in 100% made in Canada. It is a healthcare grade surgical half mask respirator. You can see it from the design of this product. It's truly a gold standard when it comes to healthcare individual cleaning product. We have built this whole product to be cleanable with the wipes, with any other avenue from sterilization to water cleaning and others. So there's multiple ways to clean and disinfect of this device is available. This device also have, as Barry earlier mentioned, new Canadian standards. It's a CSA approved. It's a Health Canada approved product, and it have been designed by healthcare providers right here in Manitoba for others. So the key aspect when we were designing this product was to bring a product which is not only comfortable and provide the safety of half mask respirator, is have to have breathability. It's have to solve the biggest problem which RFR heads were people when they were speaking through it, the voice was muffled. And the challenge with the major competition were the scenarios where half mask respirators were good. People were trying to use in emergency and surgical areas, but their communication was muffled through this device, and that was kind of taking people away from using this half mask respirators. So for that reason, we developed this enlarged portion of this breathable filter system. It's almost 3-inch diameter on each side. So this filter system works like a diaphragm, like a speaker system. When I speak through it or without it, it's almost the same. So it made the mask much more breathable, more cooler, and much more safer for the wearer. We also went with the technology where we wanted to track how many times user is able to use this mask, and if the healthcare system, especially because nobody was prepared during the pandemic, because they were so used to disposable masks, they wanted to see how they can track this mask. So we embedded the NFC technology in the masks, so one could really tap their phone over it and say how many times this mask was used. And there's also barcode system to it. Since the product is completely TPE and the materials we tested to be almost great to the hypoallergenic. So this product, as earlier my colleagues have mentioned from Dentec and so on, because the elastomeric capability of this product, this is able to fit a whole lot of people. The people who were not, they're complex to fit in any disposable mask, they can fit in most of time these elastomerics. Because these are anatomically right designs, this seals very, very well on all shapes and forms of the faces. And above all, our disposable caps are 100% recyclable. They're made from single materials, including the filter. They can be recycled, and the product's end of the life cycle is phenomenal, because you're not throwing this one in trash, you're recycling it. And the mask itself can be used multiple times. With CSA guidance now, till this mask could last people 6 months, a year or more. We do have 2 sizes for this mask, and those are small, medium for smaller faces. They have a kind of purple color. You see probably in my hand as well. I have a kind of blue mask in my hand. This is our medium large. So almost 90+% of population of healthcare workforce can be fitted with this mask at 200 fit factor. Our custom filters, which we designed, manufactured right here in Canada, they are quite breathable and they are healthcare grade level 3. So they're surgical grade. So this is one thing keeps us quite different than other product. We have surgical grade healthcare half mask respirator. It's not industrial. It's not a product for just a public use. It can be used everywhere, but it's complies to healthcare standards. And that was the most rigid way to reach out to the best mask possible for us. Our technology of, we call it Precision Air Logics, which tracks this disposable. It manages the inventory management. It does creates a definitely a strong technical advantage on this product users, as well as this product is estimated saving between $240 to $690 per employees in 30 shifts. So when you are replacing the traditional disposable product into these reusable product, it is the way to go. It is a sustainable. It is the most safer. And I'm keep saying that it is the gold standard for safety when it's come down to half mask respirator and actually respiratory protection overall in healthcare space and beyond. So, sorry. And with that, just kind of going into our future state, as we are a developer of new materials, which are plant-based materials, we are looking into developing these filters. Being a plant-based filters means these filters would be compostable, and they will have ability to do more than N95, N99, and P100 capabilities. They can be used everywhere, as we have now approved method for cleaning with the wipes and others, which is from Health Canada and beyond organizations. So this mask can be used in a community setup, in the nursings who goes to home care and others. Above all, this mask is what we have created is 100% Canadian made. It is available today. We have hundreds of people in Manitoba, Ontario, and other provinces and jurisdictions using this mask, and we are quite proud of it. And our sustainable footprint and sustainable mission and vision, which we started with this mask, continuing into other PPE, and we are now a company who is completely focused on GHG, our environmental footprint reduction, building new materials which are compostable, plant-based, beyond this product and into all the PPE of healthcare and ICS or industrial cleaning services side of the business. With that, I thank you for your time, and actually I'll give over to Barry.
Thank you, Kate. So we've developed two respiratory products, reusable elastomeric respirators, neither one of which looks like a really traditional elastomeric respirator. So a single filter as opposed to two canisters on the side, and very low profile. And our design goal is to make them as small, as lightweight, and as easy to breathe through as possible. So I'll just walk you through the two offerings here. Breathe has a reusable body with replaceable filters, and Nanomask is the first elastomeric respirator with a fixed filter or a permanent filter affixed to the elastomer. So Breathe is available in two different types. So ASTM level 3, so it's like a surgical grade ASTM level 3, and a particulate respirator registered as 95 PFE. And very low breathing resistance for both, the lowest, I believe, in the world, and both 99.9 to 100% effective against bacterial or bioaerosol transmission. They're very lightweight, about a third actually of the weight of a traditional new style elastomeric. And the old style were, very big and bulky, and some of the newer styles, are a little less than the original ones that you would have for mining or firefighting, et cetera, et cetera. Ours are about 3 times lighter than a traditional one. They're very easy breathing, easy to seal. You can talk through them very easily. Comfort is king, and I'll just show you one here. And unfortunately, I'm working remotely, so I don't have access to all the ones at the office. So this is just a prototype one I've got here with a different front on it, but it's largely the same in the back. So it's very soft silicone seal and very little pressure to hold it on. So you can wear it in an ear loop style, or you can snap it on the top of your head, or you can use head straps to take it off. And very easy to speak through as well. The slides that are on the ear loops are infinitely adjustable. The ear clip can be put on left or right, and you can basically set it up so that when you use it as a clipped version, you have a very relaxed, very gentle fit, or medium, or you can tighten it right down. The idea is to have just the bare minimal force against your face necessary to seal, so that it's very comfortable throughout the day. Available in 3 sizes, small, medium, large, and really you just have to measure from the bridge of your nose to under your chin to determine which size that you would fit into. It fits all widths of faces. When we look at the economics of switching over from disposables to reusables, this is just an example here. For example, if we have 1,000 users in our healthcare facility, and we're going to use 5 respirators per day per user when they are on shift, when they're working, it's about 1.2 million respirators that they're going to be disposing of, as opposed to using just 1,000 respirators for the 1,000 healthcare workers, and a much lower number of replaceable filters. And that's changing out the filters every day. And that's going to be determined by healthcare facility policy. We don't believe it needs to be changed every day, but that's really going to be up to the hospital to determine that. The annual savings is very significant. So $2.2 million to use disposables, $350,000 to use reusables. And if we look at the difference in the amount of waste that's generated, a typical disposable respirator weighs 11 grams and a surgical mask about 4.4, depending on which level of filter. If we're using the bioaerosol filters, they're as little as 0.9, but in this case, for comparison, I've used the particulate filters. And you can see that with reusables, we're only 0.41 tons of waste per year for those filters, as opposed to 13.2 tons of waste for disposables. Our other offering is Nanomask, and it's designed to look more like a regular mask. One of the really neat features of this is because it's so lightweight, there's no frame, and because of the specific shape of it, you can essentially fit that to your face, and even without straps, it will stay on your face. Now, you can just use ear loops for a short period of time, or again, you can extend it so that you snap a clip on the back for all day comfortable use. And taking it off is really easy. You just click the clip with one finger, and then you can pull it off and dispose of them out. So available in 2 styles, again, ASTM level 3 or 95 PFE, a very low breathing resistance for both, and 100% bioaerosol protection. It was the winner of the COVID-19 challenge that we had across the country to develop the ultimate respiratory protection for the public for COVID. And you see here again, it only weighs 30 grams. So much less than, a typical respirator, which is 150, up to 200 grams, only 30 grams. It hardly feels like it's even there. And again, one large filter that's easy to speak through and breathe through. So the communication is pretty easy. 3 different ways to use the straps again. Any universal size, because the material is so flexible. You only need one size to cover the range of small, medium, and large. And in future, we hope to come out with a children's version once we set a public mask standard here in Canada for respirators. And cleaning of the elastomer is really dependent on the application, whether you're in healthcare or whether you're just a member of the general public. And if you are a member of healthcare, then we would like to work with you to set up protocols for your specific institution, because it requires some detailed knowledge of materials and specifically electrostatic capture of viruses. There's a lot of thought that, once the viruses are captured in a mask, that there's a dangerous in that mask, where there's very little fomite transfer of SARS-2, for example. It's about 10,000 to 1 inhalation versus fomite. And once the viruses are trapped within the electrostatic material, they can neither be inhaled nor exhaled, according to a very good study done by Fisher et al. One of the things, by making it look a lot less conspicuous and more like a regular mask, you can also hide it, and so you can use it as behind other cloth masks so that it's less obtrusive. And anyway, those are our 2 masks that we offer. Oh, and this is a very interesting comment that I just noticed prior to this webinar. Made in Canada, reusable respirator, better protection, less weight, should be standard issue by now. Yes. So how can we make that happen? Thank you.
Hey, thank you so much to all of our presenters. Unfortunately, we did go right till 10 o'clock, but these things tend to happen when you have so many intelligent, well-spoken individuals on a webinar such as this. I was going to ask and see if our presenters are comfortable staying a little bit later to answer the questions. Does that work for you guys?
Yep.
Sure.
Okay. We'll just like 15, 20 minutes. Attendees, if you guys need to hop off, go ahead. Like I said earlier, this is being recorded and we will be sending out the recording to all of you. But thank you again for joining, and let's get into the questions. And again, if attendees have any questions, please put it in the Q&A and we'll try to get to those as well. So our first question for our panelists is, what are the primary challenges of getting RERs as a regularly used form of PPE in the health system? And what are your suggestions for overcoming these challenges? Barry, would you like to go first?
Yes, thank you. So legacy practice, it's hard to change, hard to introduce any change. There's a whole industry out there right now that really wants to keep things the way that they are. There's a disposable industry of multi-billion-dollar multinationals who would like to keep, healthcare hooked on disposables, for example. So making that change is hard. One of the rules with changing, the 80-20 rule is actually 10-80-10. You've got 10% of people who are in leadership position who are really, really committed to keeping things the way they are. And then you've got 10% of upstart champions of new, and then you've got 10%, and then about 80% in between who are waiting to see which way the pendulum is going to swing. Are we going to switch to something whole new, or are we going to stay the way that we are? In healthcare, we've got the really big problem of we have spent 50 years moving off of reusables in every corner of healthcare to disposables, and now we're asking people to think back to reusables again. And because it's so new, there's not a lot of role models out there right now to look at. There's a Texas Center for Infectious Disease that people keep bringing up, and that's fantastic. But we need more in examples, and especially here in Canada. Those are big challenges to get over.
Definitely. Craig, anything you'd like to add?
Yeah, definitely a few points. So first and foremost, I mean, people have the misconception that reusable elastomeric half masks are more uncomfortable versus disposables, when in fact the opposite is true. I think, we've tried to articulate today that there's a lot of reusable options that are a lot more comfortable than the traditional disposable respirators. There's fit testing challenges, but in my humble opinion, I honestly view this as an opportunity. Throughout the pandemic, many facilities had to conduct many fit tests due to lack of consistent supply. By moving to a reusable elastomeric, just one more fit test means you're set for potentially years without having to fit test on different makes or models for a long, long time after that. But like Barry said, making a running change in the middle of a pandemic is challenging. So we've been, waiting for things to calm down until we can make those changes, hopefully outside of a wave. And, basically just getting people to realize that there are better alternatives available and out on the market. A lot of the reusable options that we discussed today have only been around for about a year and a half, less. So it's a newness of some of these products that, is overcoming a bit of a hurdle right now. We need to get better awareness that there are better options out there.
Definitely. Jay, anything you'd like to add?
Yeah, just I think I can copy both of Barry and Craig's comment. Plus, my comment would be into it is really as the world is changing, people were not used to of this RFRs through the healthcare facilities and so on, but these are much more comfortable devices. The innovation which was stalled for last 50 years happened in last 2 years. So yes, there is right now there's a learning curve for healthcare users and even for those procurement department folks and others. But I can tell you this thing, the RFRs can solve all the respiratory protection problems, and all this fit testing debacles happened in the pandemic forever. We can, once, as Craig mentioned, once somebody's tested on this mask, they don't have to retest it again for next two years or 3 years. Because why? Because the supply chain is right here in Canada. And these products are so much comfortable, and the seals are much larger. They can actually, I'm not going to change the healthcare policy, but they will change. They will still be able to fit if somebody loses a few pounds or gain a couple of pounds here, there. It's not completely change of a product. Where in traditional disposable, that was the case. Plus, what we're going to leave for our kids? The piles of disposable masks because we were protecting ourselves, or smart move going towards RFRs and the solution which brought in by Canadian ingenuity back into the system. So really my ask is to get all the healthcare leaders, get on this bandwagon. Let's protect our environment and let's really care about the wellness of our people and the environment around us.
Well said. Thank you, Jay. So we had a question in the Q&A that kind of relates to our second one here. Tara said the cleaning procedures for elastomeric respirators are quite extensive when they're used in healthcare. Is there anything in the works to help reduce the cleaning process? And then our second question here, what resources do you provide to help facilities meet your cleaning and sterilization requirements? Craig, would you like to go first? Or do you need a minute?
No, I'm good. Yeah, the kids are home now. So a couple things that we have. We do have really detailed cleaning and user instructions available on our website. We also have protocols that have been developed in conjunction with and released by Cooper Healthcare Network. So you can see other healthcare facilities and what they're doing internally, whether it's being cleaned and sterilized by the person, or whether they're being centrally sterilized and decontaminated in pool sterilization. So we do have those resources that are available. We also, just as far as the fit testing is concerned, have a lot of other resources that are available for either qualitative or quantitative fit testing, depending on what your facility is utilizing. And we can also offer a lot of fit test training and support, whether that be train the trainers in order to help those facilities conduct those procedures seamlessly.
Great. Jay, any thoughts about cleaning and sterilization?
So yes, when we were developing our mask, because it was designed by shared healthcare team alongside with our engineers. So we went on a journey to get this mask cleaned in various different ways. From each hospital and it depends how they clean. Some sense to sterilization, some do the tap wash, some do the pool washing. And I think we have right now in process wipe cleaning by end user. So we have a number of ways to clean this product. Why this works? Because we didn't leave no nooks or crannies. We didn't leave no textile on the mask. So it is one of that scenario where really protection and really not having those 90-degree angles on a mask built this mask a very easy for end user to clean. So that's where we are at. And I do want to add a little bit to it from fit testing perspective too. We have developed different adapters to get this fit testing done qualitatively and quantitatively. And the data proves this mask fits more people with much less efforts. And some of your user actually in the survey, there was data, somebody was saying glasses don't fit on the mask. I know my video is probably not highlighted at this moment. I could show you our mask. We actually went and developed the little nooks on the mask itself, which really your glasses stays on top of it. So I wear glasses with the mask, and the glasses goes onto these little nose nooks on the mask itself. So innovation is keep going, and I think my partners here, Barry, Craig, and others, we will develop and we will evolve as a designs. And what really my ask to healthcare users and providers are, look into this higher security, higher safety, and the new standard. Ask for this new standard for RFRs in your facilities, because it's going to protect you and your co-workers.
Great, thank you, Jay. Barry, any thoughts on the cleaning and sterilization requirements and what resources you provide? And then also, you're welcome to circle back to your some of the suggestions you had for overcoming the challenges for getting RERs regularly used.
All right. Well, thanks, Autumn. I think the biggest resource that we can offer is one-on-one consultation with hospitals or healthcare facilities or any organization to discuss the different paradigms, the different approaches to cleaning and disinfection. So whether you use the Texas Center for Infectious Disease protocol, which is essentially the healthcare worker owns that device and they manage filter changes and cleaning, or whether you're processing through a central medical device reprocessing department. And then if you're doing central MDR, to look at the processes that they use, they prefer, et cetera, because there are a number of different ways to treat these. And so I think that one-on-one, taking the time to thoughtfully review to see what works best at organization is probably the best resource that we can offer. As far as overcoming the challenges that you had asked about in your first question, I think there's really three things. So find the champions who are out there, that 10% of people who are, really committed to doing things newer and better, and empower them. Share the benefits like we're doing today about, protection, comfort, economics, the environment, et cetera. And then three, ask people to just step back for a second and think about it. If we didn't already have this legacy practice of disposable, throwing things out all the time, if we were just starting fresh, would we really scale a system that costs 10 times as much, provides 10 times less protection, and is 10 times more harmful for the planet? That is the disposable route. I don't think we would. And, just ask who benefits from that approach.
Great, thank you, Barry. Before we get on to our questions, we did have a couple comments in the Q&A regarding moisture buildup, so maybe we could talk about that quickly. So I guess my question for you guys is, what changes have you done to your respirators to help address moisture buildup? What suggestions do you maybe have for wearers to help mitigate that issue? Jay, would you like to go first?
Well, thank you. I do want to a little bit answer the earlier question as well about the resources available. We do have Train the Trainer program, and we do have fit testing resource available. If any hospital or organization want to reach out to us, we do provide those services as well. And we support our product from our engineering department throughout the product acquisition, training, and deployment, and so on. And as per the product safety and you said moisture and breathing goes, from our product perspective, we did create healthcare grade product. Yes, it does not have the exhalation valve, but to reduce that moisture built up, to reduce the drag for the air and increase the flow of the air and speech intelligibility, we end up creating the filters. So it does look much bigger filter than most of sometimes low profile masks would have, but this was a reason behind it, was build a larger filter set, give a much larger area for breathability, which reduces the temperature inside the mask and also increases the speech intelligibility of the mask when end user is wearing it for a long time. So in our product design, the basic fundamental thing was to have a most comfortable mask, which is less humidity, better speech intelligibility, much easier breathing, and cool status for the mask overall when wearers comfort when they wear for long term.
Great. Barry, do you want to talk about how you're mitigating challenges with the potential moisture buildup?
Sure. And I don't know if you can see, can you see my screen? No, I don't think so.
Yep, we can.
Oh, you can. Okay. So on this product, for example, there are very few condensable surfaces in here. It's mostly filter. And in fact, in a future version, you won't see this frame in here either. And in this version, you've got a fairly deep frame. And so the filter is fairly far away. Reducing the proximity of the condensable surfaces, I find, makes a big difference, and then the amount of condensable surface area inside makes a big difference. So the more filter there is, or the further away it is from the source, the less condensation you're going to see. And so that's what we've been working on. But you are going to see condensation in all elastomeric respirators. One of the reasons that you don't see it in disposables is because they leak. And it doesn't take much of a leak to equalize moisture inside, or to reduce condensation inside of a mask. And if you don't have condensation inside your disposable, it's in large part because there have been micro leaks, small leaks throughout the day as you've been wearing it. So elastomerics, if you do get moisture buildup inside, it's definitely showing you that you've got a good seal.
Any additional thoughts on your end, Craig?
I would echo, similar to what Jay and Barry have already commented on. To Barry's point, if you do have some condensation buildup, you probably have a really good seal, which is a really good thing. So, there is the possibility to take scheduled breaks throughout the day, potentially wipe down any condensation buildup that has occurred. But in the design process of our mask, we've looked at similar considerations that both Jay and Barry did as well. Having a large filter, this is an example of our N95, it's a little bit over 3 inches. Having that surface area does help to reduce condensation as much as possible. This is an example of our P100 cartridge. On the inside of the P100, it's pleated as well. So there's a very, very large surface area of material that you're able to draw air in and exhale out through as well. So, it's all stuff that we've tried to think out as best as possible. But at the end of the day, some condensation buildup shows that you have a really good seal in your mask. And to kind of echo what Barry had mentioned earlier, you are getting a much significantly higher level of protection, 10 times, I believe he had quoted, better protection. So it's, there are some trade-offs in this. Thanks.
That's actually something I'd never really thought about before. Like, of course, like the better the seal, the more potential moisture buildup. Okay, we'll go to the next question here. So what do you see as a priority for future research? Barry, would you like to go first?
Sure. Well, I think we really have to focus on human factors, number one. So comfort, communication, and ease of use. That has to be a bigger part of our standards. Pragmatic paradigms, whether you use the Texas Center for Infectious Disease model, where a healthcare worker owns that, safety device that they're using every day. They own lots of other pieces of equipment, whether it's a stethoscope or their, name tag or whatever that they look after every day. This is one more piece that would be in their charge. The economics really need to be highlighted and researched and spoken about. Healthcare can't continue on the way that it is. And not just the economics of the cost, but the benefit to patient outcomes, the benefits to disease. About 25% of community cases can be traced back to healthcare for COVID. And if you have elastomeric use, if it was universal elastomeric use, you would stop that transmission within the hospital and you would reduce community cases up to 25%. So all of those economics really need to be studied. And then, of course, the reason we're here today, the environment. We need to see the impact on the environment. We need to see more studies there. Share them more than anything.
Mm-hmm. Definitely. Craig, any additional comments on that?
Yeah, I would just, echo other facilities who have adopted elastomeric use. Allegheny Health Network out of Pennsylvania is another big one that has seen huge environmental sustainability advancements by moving over to reusable options. Believe their staff saw somewhere in the degree of 95% reduction in waste of disposable N95s versus their elastomeric use, and then about a 90% reduction in costs. So, more research on that front, as Barry had mentioned, would be greatly advantageous to the industry.
Definitely. Jay, would you like to
Well,
speak on this as well?
Yes, I'll just probably make it very brief in this perspective. I really 4 key terms I'll use to describe what the priorities need to be. I think sustainability is the key, because if we took care of environment and everything around us, the nature will create the wellness around us. It will protect us because nature is the best protector around us, and it can destroy us as well if we don't become really, compliance with existing status quo. So it's time to really, challenge the existing status quo of disposable. We can do that with our RFR products, which are much safer. They're much comfortable. And above all, I'm not relying on a factory in South Asia to get me a product when I need the most. And really, when we were in the healthcare side of the business, when we were buying the PPE, it was look like mafia deals were happening. People were going with the cash to the factories, and the product, which is used to be 10 cent, 12 cent, was selling for $6. That's not a reasonable, that's not a Canadian, that's not a North American way of living and how we treat others when they are in need. We are the nation of givers, and we are the nation of passionate people who help protect others. And I think from our perspective, our company works on this drive of passion and to really change the way how things are out there. We always really stand out. I know Barry and other, my coworkers can vouch for that. We always stand out for challenging the status quo. We are doing that with this RFR and now with our plant-based materials, and we're going to keep doing it into the future. But we do need Canadian health system to trust on Canadian folks. Give a chance, and then let's change the world together.
Very beautifully put, Jay. Thank you. Okay, we have one more question here to go through, and we're going to be quick so we can finish up before 10:30. So do you have suggestions for knowledge translation? What types of knowledge translation would be the most useful? When we have our webinar like this, but what other things might you suggest? Craig, would you like to go first?
Yeah, definitely. More case studies are needed, more knowledge around successes that facilities are having by adopting reusable elastomeric respirators. That's really, really important. So that's why we've put a lot of effort into developing some recent case studies, not only in the healthcare field, but on the dental side as well. But we need more support in Canada from our provincial and federal governments as well. We know that these products work, they provide better protection, are domestically manufactured with raw materials that are produced here as well. And we need the provincial and federal governments to be talking about how viable of a solution these are for our healthcare workers and how we can keep them protected and thus the public protected as well.
Great. Thank you, Craig. Jay, any suggestions for knowledge translation?
Yes, I think it's still when there is a people in healthcare, when people are wearing RFRs, some of them are still under the dilemma. Oh, this is RFR, this is big, even it's protecting me. I don't want somebody to feel offended with it. I don't want to feel, there's a dilemma about it. But there was always dilemma about healthcare as well, right? So people have been working on marketing campaign, like, not all the hero wear capes, right? Some, not all the angel have wings sort of scenarios. So I think we need to bring the RFR into the mainstream somehow to remove the dilemma around it. They're big, they're bulky, or they look different, even though healthcare workers are quite knowledgeable about the safety and security of their own. Sometimes they go towards the cosmetic. We need to remove that out. And I think Greg already stole my points, both from Canadian government and provincial governments. Really, what happened here is when we needed a healthcare grade half mask respirator, our story, the biggest challenge we had was everyone was asking for NIOSH. And NIOSH was, be open with you, they were not working on Canadian application on priority basis, and they're still not. So our healthcare system have their standards based on American standard and written into the American standard set, which really kind of created a lot of challenge for us. So we have to go in and change policies of OISH in province by province basis. I think that's something Canadian government and each jurisdiction government can do. And lastly, as US government, you've seen, and Craig can vouch for it, they procure product like this to support the innovation, support the cycle, to get kick-started. And that didn't happen in Canada. So there's no half-mask procurement happened, Canadian-based half-mask procurement happened in Canada by Canadian government at all. Yes, provincial government, each hospital facilities in Ontario and others, they did procure our products, and we are quite grateful to them for that. But it's, I think, Canada government or Health Canada, and PHAC, they do need to do something about it to make it standard, to sow the seed for the future safety and security.
So true. Thank you, Jay. All right, Barry, any closing statements here?
Sure. Yeah, as far as knowledge translation goes, there's been more study done in the last 2 years in this whole field than has been done in the last 100 years. 277,000 COVID studies in the last 2.5 years. We've done more modeling. We have a supercomputer billion atom simulation of a bioaerosol. We know how airborne transmission works, not just for COVID, but a lot of diseases now. And we're starting to accept that more diseases are airborne. We know what bioaerosols are and their characteristics now compared to regular particles. We didn't know any of that before. We know all the filter characteristics inside and out now and what's required for particles versus bioaerosols, the importance of fit and seal, all of that. Now we have to share it. And so this webinar is fantastic for that. We need more webinars. We need in-house education in hospitals and healthcare. We need a big promotional movement, just like we have for hand hygiene in healthcare for 40 years now. We need the same kind of thing for respiratory protection, for airborne disease mitigation. And as Jay mentioned, we need to share these success stories. And I think Craig mentioned it as well. If, people who have put them at Texas Center for Infectious, or in Pittsburgh, Allegheny, Pittsburgh, people who have used elastomerics to great success, we need to get those stories out. And we need a deeper exchange. So knowledge translation requires a two-way, it's an iterative process. We need a training and education in med schools. We need those discussions in nursing schools, and we need to start including patients and families, not just giving them products. Rosemont Maisonneuve Hospital in Quebec has now started giving N95s to patients and their families when they visit. That's extraordinary. That's fantastic. We need to share those stories. And we need to start discuss then the impact on hospital-acquired infections when they do move to universal use of masks, and universal respirators, even better, and then universal elastomerics, because you'll see it's, good, better, best, and we need to share that. So thanks, Autumn.
Thank you, Barry. And thank you, Jay. Thank you, Craig. Thank you, everyone who attended today. We really appreciate your time. And for those of you that stayed, we appreciate you staying through to this point with us as well. I hope you all enjoy the rest of your day and keep an eye out for the webinar recording. All right. Take care, everyone.
Thank you.
Thank you.
Thank you.